Dr. Muyiwa Aina. He's the Executive Director of the National Primary Healthcare Development Agency in Nigeria. Dr. Muyiwa, good morning and welcome to the program.
Good morning and welcome.
Great. So let's start from this week. This week we saw the second reading of a bill that's seeking to repeal and reenact the National Primary Healthcare Development Agency, your agency, the Act. It's supposed to promote equitable access, accountability, and all. What are your expectations? And I believe you are part of this process of this new bill, but what can we expect at the end of it?
I think what is very encouraging, what we're happy about, is that everyone now recognizes the centrality of a well-functioning primary healthcare system to the delivery of the presidential mandate on effective, high-quality, equitable health services to Nigerians. So we were very heartened, when we learned about efforts by the National Assembly to actually intervene in using a legislative tool to try to improve the way we function as an organization, but also the way we manage the system. I think ultimately, we're operating under a health sector blueprint that is led by Professor Mohamed Pate, the Coordinating Minister for Health and Social Welfare, that has 4 pillars. The first pillar is around the governance system. So having accountability, using data for decision making and engagement with Nigerians, as well as coordination between the different tiers of government. The second pillar really focuses on service delivery, the provision of high quality services to Nigerians at all levels. The third pillar is on the value chain of the health, making the business of that and making that more sustainable, while the fourth pillar is on health security. So what we expect of any transformations to our law is such that it enables the National Primary Healthcare Development Agency to more deliver effectively along each of these dimensions, especially, the second pillar, which is really around service delivery, because our role is to coordinate primary healthcare services. But at the same time, we want to have a strong, accountable organization that Nigerians can and do engage with frequently. We also want to contribute our quota to health security because, the NPHCDA, in partnership with the 36 states and the FCT, oversee over 30,000 primary health centers across the country. And these are the service outlets. These are, if you're able to set them up to be sensitive, to detect and respond to disease outbreaks, I think we can all have a more secure health system.
The states, because when you look at basic healthcare provision or primary healthcare, you were really talking about the states, the local governments there. How involved are they? How much of the activities have you keyed into even the reforms that you're working on?
I think, again, we're fortunate in that perhaps more than any time in the recent past, we now have an agenda that both the states and the local governments and even non-government players, so the development partners and the CSOs, are largely keyed into. You may be aware that the health sector under the minister is operating a sector-wide approach as a mechanism to implement President Tinubu's compact with the state governors and the development partners. In fact, in this week's joint annual review, an addendum was signed to that original compact that brings in the local governments and the traditional leaders as well as CSOs, so that everybody is aligned against a set of goals and a set of approaches that were undertaken to be able to improve health outcomes for Nigeria and the sustainability of our health system. So through this MOU and a number of cascade efforts, and the federal government, all the institutions, the FMOH, Federal Ministry of Health, the Primary Healthcare Development Agency, the NHIA, the NCDC, all of us now have better ways of engaging with the states through frequent interactions, getting input from them, but also providing input and exchanging ideas. Again, you may be aware that the service delivery ultimately is the responsibility of the state and local governments. And so the role of the federal government is to guide, to provide policy, to govern, but also standards and regulation. And, we are now working very closely as part of the SWOP with the states and the local governments, but also very importantly, not just those as well, the development partners as well and CSOs.
And I guess health financing is another area that would, be focused on in this reform.
That is correct. That is correct. In fact, a few weeks ago, our sister agency, the National Health Insurance Authority, hosted a health financing summit that brought together many stakeholders, intergovernmental stakeholders in Nigeria, the ministries of budget and planning, finance, health, and many others, but also international partners, both donors and potential private investors as well, to really discuss how we jumpstart, the financing of health services in Nigeria. The Basic Healthcare Provision Fund is the core of primary healthcare financing. The amount of resources that is going into that, at least in Naira terms, has been increased substantially by President Bola Ahmed Tinubu. And what that is allowing us to do is to increase the number of health facilities that receive money directly every quarter for operations, but also increase the amount of money that is going to the health facilities so that they are better positioned to be able to provide, to serve Nigerians that come into them. But beyond that, there's also investment at the secondary level, at the tertiary level. At the federal government level alone, the budget for health, has more than doubled over the last couple of years. But that's far from what we still need. That's not enough. If you think about the requirements for the health workforce, for the infrastructure, for the commodities, and basically to diagnostics, equipment, technologies that we need. So this government is pushing very hard on a number of fronts to improve the sourcing and pooling of resources in the health sector, both what the government is doing at the federal level, at the subnational level, states and local governments, but also what we're making better use of what we are able to source from some of our donor partners and the private sector, also increasing the role of private sector, because in many countries, the healthcare is a major driver of GDP, and there's no reason why it cannot be that in Nigeria. And you can already see movement in that direction as well.
To hear and see the participation of more private sector in Nigeria's health sector, and of course, when there are incentives, funds will head there. So we hope that's available and that's made known. The Executive Director, National Primary Healthcare Development Agency in Nigeria, Dr. Muyiwa Aino, thank you so much for your time.
Thank you.